Hello everyone. This week we began our Phase 7 action plan. Phase 7 maximizes all previously implemented measures to contain movement and decrease the spread of the virus and includes the use of 3 strategic inmate testing and quarantine sites, which are at FTC Oklahoma City, FCI Victorville Medium 2, and FCI Yazoo Low, along with all the detention centers and jail units throughout the Bureau. These sites will utilize the Rapid ID Now instrument and test kits, along with a national contract to conduct COVID-19 testing. Phase 7 will remain in place until June 30th, 2020. We continue to monitor the progression of the pandemic and make strategic and operational adjustments as we move forward. As a result of our increased testing, we have seen increased numbers of positive inmates at some locations. Our medical experts believe our proactive testing approach will significantly shorten the overall span of the virus within our prison system. Even though our numbers appear high, what is typically not being conveyed in the media is that many of these positive inmates are asymptomatic. They are not showing any signs or symptoms currently associated with the coronavirus. These inmates would not have otherwise been tested, but because we have done so, we can monitor them appropriately. We continue to follow CDC guidance for all positive cases and place all positive inmates, whether symptomatic or asymptomatic, in isolation accordingly. Today there are 2,351 inmates with current confirmed positive results. The number of inmates that have recovered continues to be encouraging and has climbed to 2,112. Staff recoveries also continue to rise, with more than 375 staff now recovered. The 196 staff who currently have confirmed positive results remain in the forefront of our thoughts and prayers. In recent weeks, many local community leaders have made statements in the media regarding our failure to mandate staff testing and expressed concern that we may be spreading COVID-19 among the community. We are part of each community where our staff live and work, and I believe increased testing in those communities, which include our staff, will help reduce the spread of COVID-19 into and out of our institutions. We cannot require that staff members be tested for COVID-19. However, I encourage wardens to identify and publish available testing sites in the community where interested staff may be tested. Each week I have been focusing on the great work our staff on the front lines have been doing. I am thankful for their continued dedication and commitment to our mission while facing such unprecedented challenges. I have also acknowledged the medical staff and the secondary law enforcement staff around the nation that have deployed in order to assist our locations in need. I am grateful for their willingness to fulfill the primary mission of our agency, to protect the public. Today, I also want to recognize our staff working behind the scenes. Those staff who are in our command centers, the staff working as liaisons with DOJ, Congress, and the media, and other stakeholders, the staff at the DSCC and in institutions adjusting computations, the human resource staff working on pay and benefits, the contracting staff diligently working to acquire the PPE and testing supplies we need, and the facility staff working to stand up temporary mobile care units. So many other staff across the country. These are extraordinary times, and it takes every one of us working in concert to provide a safe environment for everyone. I also want to acknowledge the local union presidents, with a highlight on the Western region, for their extra efforts and willingness to work hand in hand with their wardens during these challenging times. Along with Regional Vice President John Kostelnik, the union and institution executive staff are standing together as one team and communicating a transparent and accurate picture to their local elected community officials, congressional representatives, and the media of our agency's efforts in responding to the COVID-19 pandemic. Additionally, Gregory Watts, Union President at FMC Fort Worth, has worked diligently with Warden Wilson to find ways to assure the mission could be carried out safely. They have served as role models to staff in support of wearing face coverings, played a vital role in establishing the positive working relationship between the FMC and the local hospital, and provided accurate media interviews. They also coordinated with local public health officials to give staff access to testing, which addressed concerns from the state and federal representatives regarding testing. The positive support and collaboration local union leadership has provided at these locations contributes to the success of our staff and agency as a whole, and I am proud of the work they are accomplishing together. I want each of you to continue to serve as positive role models to your colleagues and the inmates entrusted to our care. Stay healthy and safe, work hard, and be proud of what we accomplish every day. Together we are stronger. Together we are making the difference. Thank you.